Bismillahirrahmanirrahim. This is Dr. Hooria Aamir, and I welcome all the class of first year as well as BDS to my lectures regarding heart physiology. Now, this is very important topic, including cardiovascular physiology, and we are going to do this topic in two halves. The first half is going to be composed of the heart physiology, and the second one is the circulation. So, I think all of you must have the basic idea of heart with you. What is this heart composed of? What is the basic muscle component which is making the heart? Now, the concepts regarding the fluid flow, the action potentials, as you have done the nerve and muscle topic up till now, so you know what is action potential. But over here, the action potential is a bit different in comparison to what you have done up till now in smooth muscle and skeletal muscle. And over here, in case of heart, when we are doing it, the topic which is actually the heart and soul, and you can say the core of this topic, that is the cardiac cycle. You should be knowing this by heart. All of you keep this thing in mind, that if you want to pass the topic of heart physiology, cardiac cycle is a must. So all of you should learn and revise and draw in detail in your logbooks as well. What are the different features which are making cardiac cycle a cardiac cycle? What are different electrical activities taking place? What are mechanical activities taking place? What are the different sounds which are being seen, the pressure changes, the volume changes, and so on. Then we should be knowing about the heart rate regulation terms, the stroke volume, the cardiac output. So these are actually the basic concepts, and the books I would like to recommend about, they are one and only Guyton. You all are supposed to learn it from there, read it from there, learn the diagrams, and the first thing and the last thing which is very important is that all of you should know how to draw and label the cardiac cycle. So today we are going to just have the introductory lecture regarding this. Now, I think this diagram, all of you have seen it for so many times up till now. It is there in the metric book. It is there in the FSC book as well. You can see that the heart is actually a dual pump. Now, what does this dual pump means? It means that there is presence of two different pumps at the same time. One is on the right side and the other one is on the left side. So when we are thinking about the term about a pump, then we should be knowing that what are the different things which are making it. You can see that in the center there is presence of the basic pump, and what is that? That is the heart, right? And then we have on the right side and the left side there is presence of arteries, veins, and then there is actually the third component, very important, and what is that? That is the circulating blood. So whenever there is a pump system, we should be knowing that the three basic components, they are there. The first is the heart, that is the basic pump, that is actually forcing some whatever things they are coming to it, and the things coming to it, they are, you know, that is the blood. And number first is the pump, heart. Number two is actually the areas for conduction of that thing which is to be pumped by this heart. And what is that? That is actually these circulatory organs, circulatory vessels like arteries, veins, capillaries, etc. And the third component is actually the circulating fluid medium which is to be pumped and to be circulated. And what is that? That is the blood. And you know quite in detail about what is this blood and what is the composition of blood and what is the basic things to be done. Now let's see about this. You can see that there is presence of two dual heart is showing that there is a right circulation, there is a left circulation, you can see, and how it is supplying the different areas of the body, how it is supplying the head and brain, how it is supplying the lungs, how it is supplying the trunk, the liver, the legs, the kidneys, etc. Now let's talk about blood flow. Now the question arises that why does blood flow through cardiovascular system? This is quite a layman question. So we should be knowing that because the diffusion is too slow to support a large and complex organism. So that's why the cardiovascular system that is required so that the blood should reach the far-flung areas of the body which are quite far away from the heart, right? So whatever blood that is coming to it which is oxygenated, that has to go to the far-flung areas, and the main driving force is the pressure gradient, and it is the main driving force for flow through the vessels. Now, what is this pressure? The hydrostatic pressure is in all directions and is measured in millimeters of mercury. The pressure to raise a 1 centimeter column of mercury is equal to 1 millimeter. And the apparatus by which it is being measured, that is the sphygmomanometer. The flow is produced by driving pressure. Now pressure of fluid in motion decreases over distance because of energy loss due to friction. So we should be knowing about that how this pressure, which was there quite high over there when it actually left the heart, and is quite low when it is reaching the lower areas of the body because of the loss of energy due to friction. Now this is Poiseuille's law, and we are going to do it in detail when we'll be doing the circulation. The velocity of flow also we are going to go and do it over there in the circulation. Today is the introductory lecture, so we should be knowing about the nature of the cardiac muscle at first. We should be reviewing the heart and circulatory system anatomy. One-way flow in heart is ensured. How? The heart muscle cells, they are actually 99% of them, they are contractile, and they are composed of the heart muscle cells, and the 1% of the cells, they are actually autorhythmic cells. So they are actually non-conducting type, non-contractile, but they are autorhythmic. So let's see what is the flow path of blood through heart. Now what happens is that whatever the deoxygenated blood is going to enter in the heart from the upper part of the body as well as from the lower part of the body, they are going to enter the right atrium, and by means of superior vena cava and inferior vena cava. And when they enter the right atrium, after that they are going to enter the right ventricle. You can see the blue area showing the deoxygenated blood. Now from here what is going on is that they are going to enter the lungs, and they are going to go there, and over there their oxygenation that is to be done, and the oxygenated blood from the lungs later is going to enter the left atrium, and then that is going to go to the left ventricle. So left ventricle, as it has the maximum work to do, the maximum pumping is to be done by the left ventricle. That's why its muscle is quite large, quite in bulk, and it is actually its pumping that is going to lead it to pump out the blood to the aorta, and later on from aorta it is to be distributed to different parts of our body. So this diagram is quite important as well. The pathway of a blood should be well known to you. And what is it? Again, you can repeat it with me, like that whatever deoxygenated blood is going to come to the right atrium, that is by the help of superior vena cava, inferior vena cava, and then it is going to enter the right ventricle, and the right ventricle and left and right atrium, they are being separated by means of valves, and which is the tricuspid valve. And then from here the deoxygenated blood is going to go via the pulmonary trunk to the, or you can say that it is going by the help of the pulmonary artery, it is going to go to the lungs for oxygenation, and over there the task of oxygenation that is being done, and then by the help of the pulmonary veins, the oxygenated blood is going to give back to heart, that is to the left atrium. And here there is presence of, again, between the left atrium and left ventricle, there is again presence of the ventricle, there is presence of the valves, and again that the valves, they are there to prevent the regurgitation of the blood back. And then with the help of when the blood oxygenated blood reaches the left ventricle, the oxygenated blood that is going to be pumped out by way of aorta and to be given up to the rest of the body. Now we should be knowing about the unique microanatomy of the cardiac muscle cells. And what is it? As I have already told that there is presence of 1% of the cardiac cells which are autorhythmic. And what is this autorhythmicity? That is that they are going to rhythmically contract by themselves. That is, the signal to contract is myogenic. It is not neurogenic as it is there in case of muscles. Now, how it is possible? In how this conduction that is taking place? You should be knowing that there is presence of the intercalated disks with gap junctions and desmosomes. Now the intercalated disks, these cardiac muscle cells, they are in such a way that they are actually branched, and all the different muscle cells, they are actually joined to one another with the help of intercalated disks. Now these disks, they are actually having the electrical link and strength. The sarcoplasmic reticulum over here is smaller than in the skeletal muscle. The extracellular calcium initiates the contraction like that of the smooth muscle. And there is presence of abundance of the mitochondria to extract about 80% of the oxygen. Why abundance of mitochondria is over here? Yes, it is required over here because most of the work, it has to contract again and again autorhythmically and is continuously requiring the oxygen. So that's why the abundance